Hello everyone, Assalamu alaikum. This is Dr. Rashida Mushtaq, your mentor and course director at Indigo Medics Master. Today we bring you an important discussion on a very high yield topic. This is very important for both your written and Viva examinations. But today we have, more focus on the written examination that is upcoming in August 2026, and we'll be making you focus on all the important aspects that you need to remember to, solve your MCQs. Right. So, what is a preterm birth? Term is 37 weeks and preterm birth is before 37. So how much till before 37? 37 तो कट ऑफ हमने कह दिया कि 37 से पहले जो होगी वो होगी क्या preterm delivery. So you divide the pregnancy in 3 trimesters. The first trimester is from week 1 to week 13. The second is from 14 to 27. From 28 weeks onwards, you have your third trimester. But the cutoff for age of viability is 24 weeks. So before that, we call all the losses as miscarriages, be it first trimester or second trimester. And after 24 weeks, we call it as birth, right? So this is how you get the definition in your mind that after 24 weeks till 36 plus 6 weeks, whatever we are getting in terms of deliveries, that are called preterm deliveries, right? Incidence is 7.1% overall. So this is your first important figure that you need to remember. Then the WHO division of the preterm deliveries into 3 categories. This is very important. First is extreme preterm deliveries that are from 24 weeks to 27 plus 6 weeks of gestation. That is just before your third trimester starts. Okay, the incidence is 0.4%. The second category is very preterm birth. The very preterm birth is basically from 28 weeks onward, the start of your third trimester, till 31 plus 6 weeks of just pregnancy. And this is the most common type of preterm birth, that is very preterm birth, right? This is 5.5%, a very important point regarding your MCQs. The third type of preterm birth is moderate to late preterm birth. That is from 32 to 36 plus 6 weeks, and this is 0.7%, right? So the very preterm is the most common. Extreme preterm and moderate to late preterm, they are just equal to each other in terms of incidence, right? So there are 3 types of preterm birth. First is suspected preterm birth, then is diagnosed, and then is established, right? The suspected is that you have symptoms of preterm labor, that is regular onset of uterine contractions, and then there is a cervical change. Clinical examination shows a possibility of preterm labor. Cervical examination, the speculum examination, we do not do a PV examination till we see that she is going to deliver or there may be some other indication, right? You do a clinical examination in terms of speculum examinations, and you see that there's a possibility that she might be dilated, right, before she should be. So this is a suspected preterm labor. Diagnosed preterm labor, when you suspect, means you have symptoms plus the clinical examination shows the possibility of the preterm labor. There is a suspected preterm labor plus a positive diagnostic test, means the TVS or FFN testing, fetal fibronectin testing, they are positive for preterm labor. Okay, they are telling you that she is in preterm labor. Established preterm labor is when she has a progressive dilatation of cervix that is passed onwards from 4 centimeter. Okay, regular contractions हैं. You are trying to tocolyze, you are giving her treatment like in terms of steroids, magnesium maybe according to the gestational age, or you are tocolyzing her, fluid दे रहे हैं, आप cause को देख रहे हैं, why the preterm labor was there, and you are trying to solve the problem so that she can deliver safely, in the safe limits of gestation. But she has, you did an examination now and pains are not stopping. So after 1 hour or 2 hour, again you did an examination that showed a progress from the previous examination, and that is beyond 4 centimeter. So you label it as established preterm labor. Okay. Now, what is a fetal fibronectin protein? This is a protein that binds your amniotic membranes to the uterine lining, right? So this is a binding or adhesive protein. So जब भी labor होगा तो यहाँ cervical area के ऊपर से when it is dilating, the membrane is separating from the parts of the uterus. So the fetal fibronectin protein is being released outside, right? So we can use this protein or a cervical length that is measured by transvaginal scan to diagnose the preterm labor or to confirm the preterm labor, right? So how you go about the preterm labor? Suspected preterm labor, you suspect that she is having regular uterine contractions and there might be a clinical possibility that she is having one. So you look for the gestational age. If it is equal to or less than 29 plus 6 weeks of gestation, straight away start the treatment for preterm labor. That is, give her steroids, tocolyze the patient. Okay. But if she is equal to or more than 30 weeks of pregnancy and you see a cervical dilatation on speculum examination, you see that it is less than 4 centimeter. Okay. There's still a chance that we can stop the thing and we can prolong the pregnancy. Please get a TVS, first investigation, if she is less than 4 centimeter. First investigation is TVS for cervical length. If it is equal to or less than 1.5 centimeter, very less cervical length, this is a diagnosed preterm labor. So they will give you questions that she is this much weeks of gestation, she is 32 weeks. Now, on speculum examination, you think that there is a cervical dilatation and she might be in preterm labor. What will be the first investigation that you are going to do to confirm your findings? That is a TVS, if available. Okay. Agar availability nahi hai, they will tell you. Agar nothing is mentioned, so exam is an ideal situation. Okay. So assume that TVS is available and you see the option and choose that. Okay. Agar wo aapko de dete hain ki TVS is being done and the length is more than 1.5 centimeter. So what you do? This is unlikely a preterm labor, and we are going to discuss the benefit and risks of ongoing home, ongoing management at home or treatment at hospital. And we explain then the signs and symptoms of preterm labor. And if they develop them again, they can come back to us if they choose to go to home. So ये दो बुक की गाइडलाइन की लाइन है. हमें MCQs में जरूरी नहीं है कॉपी पेस्ट वो यही दे दे. So you can choose conservative management or expectant management. If they give you cervical length more than 1.5 centimeter, right? If they give you cervical length that is less than, very less cervical length, you diagnose the preterm labor and you manage it accordingly, right? If the TVS is not available, then the second option, that is fetal fibronectin testing, you are going to get the sample and check it, right? And if it is equal to or less than 50 nanogram per DL, then it is negative and she is not in preterm labor, and you discuss again this option with her, right? If it is equal to, if it is more than 50 nanogram per DL, then she is positive and she is diagnosed preterm. Please manage her accordingly, right? If both TVS and fetal fibronectin testing are not available, then what you are going to do, you diagnose it as preterm labor and manage it. अगर वो नहीं भी है तो कुछ अगर जा भी रही है तो she will be managed in time, and if she is going to preterm labor, then the baby will benefit from the management that you are going to do in terms of steroid tocolysis, right? So that is all for preterm labor. See you next time, inshallah. Thank you. If you have any questions, you can post in the groups. We have free groups, or you can post in the comments here. Thank you.